and welcome to our special show. I'm Gargi Rawat. COVID has shaken up the world in more ways than one. While COVID has given rise to new challenges and uncertainties, the pandemic has also yielded some valuable lessons. What we eat, our exercise habits, general hand washing, hygiene awareness have garnered greater focus. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted, and as a result, metabolic problems have become more common. Unhealthy eating habits, lack of physical activity, and the mental toll of quarantine, isolation, and even the fear of contracting the virus in healthcare settings all have adversely impacted people with diabetes and heart disease. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat diabetes, myths and facts will help impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy lifestyle. Well, joining us, we have Dr. Aastha Gupta, MBBS, MD Medicine, PG Diploma, Endocrinology, UK, Consultant Diabetologist, Apollo Spectra Hospital, Delhi. We have Dr. Ravi Sankar Erukulapati, MBBS, MRCP, UK, CCT, GIM, Diabetes and Endocrinology, Senior Endocrinologist, Apollo Jubilee Hills, Hyderabad, and Dr. Zainulabedin Hamdulay, MCH, Thoracic Surgery, MS General Surgery, DNB, Cardiothoracic Surgery, Director and Chairman, Chief Consultant for Cardiovascular Thoracic Surgery, Masina Heart Institute, Mumbai. Thank you so much, doctors, all for taking your time out to join us on this program. And I'd like to start with you, Dr. Aastha Gupta. How has COVID affected people with diabetes, especially those who had uncontrolled blood sugar? How do such people cope up in the post-treatment of COVID infection?
First of all, thank you so much for inviting me. I feel very honored and privileged to partner with all of you to spread awareness about diabetes. Regarding the COVID, how it has affected, we all know that diabetic patients need regular lifestyle management, that is regular exercise and healthy diet. But COVID has led to lockdown, which has affected the lifestyle and hence increase in diabetic related complications. In the last few months, I have seen many cases where patients' sedentary life and unhealthy eating habits have led to worst outcomes. So, diabetic patients who have successfully recovered from COVID-19 not only should monitor their blood sugar levels and HbA1c regularly, but they should do regular exercise, eat healthy and balanced diet.
All right, Dr. Ravi, now it's now quite well documented that people with diabetes are more prone to COVID infection. They're more vulnerable. Are they prone to other infections as well? And is their immunity low against infections, including viral infections?
A good question, Ms. Gargi. To cut the long story short, diabetes, especially poorly controlled diabetes, can affect the immunity adversely. Be it bacterial infections, viral infections, or fungal infections, all these can be increased in people who have diabetes with poor glucose control. So let us take the example of a pneumonia such as pneumococcal pneumonia. These are more prevalent and the risk of dying with these infections is far higher if somebody were to have diabetes, especially if the control is bad. And if you take the example of viral infections, we already have COVID, but we do have multiple other infections such as your good old flu or bad old flu, as you might want to call it, which can increase the risk of susceptibility if at all somebody were to have poorly controlled diabetes. Then comes to fungal infections. We already heard about black fungus, otherwise called mucormycosis in medical terms. People can have increased susceptibility to such fungi if at all people have blood glucose control that is above the normal range. And last but not the least, people might have realized that they are susceptible to simple infections such as vaginal thrush, balanoposthitis, if at all they do have poorly controlled blood glucose. Hence the reason as to why we need to keep the blood glucose levels under good control, and one need to stay away from these infections by doing so.
I thank you for that. Dr. Hamdulay, it has been observed that patients with COVID are more prone to cardiac ailments. Cardiomyopathy and cardiac failure are also quite common in such patients. Why does this happen and what steps can they take to prevent this?
So COVID-19 is primarily a lung problem, but it has been seen that it can affect heart also. Now, the affection can be either direct or indirect. Direct in the sense that it causes myocarditis or inflammation of the muscles of the heart, resulting into weakening of the muscles of the, and indirectly by affecting the lungs, which will result into decrease in the oxygen level of oxygenation of the body, and the heart now has to pump much harder to supply the body with same amount of oxygen. Now, patients who have already been cardiac patients, now such hearts cannot cope up with this extra load and can end up into heart failure. Also, we have seen that in COVID-19 patient, there is high propensity of blood clot forming into the blood vessel. Now, when these blood clots are forming in blood vessels, a patient can get heart attack. That means when the heart attack happens, the heart muscle die, and this can result into permanent damage of the heart muscle. So all these patients, if we don't take care, can end up into heart failure or chronic heart failure as we call. These patients need to approach their doctor because we need to start the treatment as soon as possible.
All right. My next question to Dr. Aastha Gupta. It's natural for people with type 1 diabetes to worry about the possibility of passing this condition on to their children. Now, should they really be worried about this? And, what can they do to ensure that their children don't have diabetes?
People with type 1 diabetes should not worry too much about passing the condition to their children. Unlike type 2 diabetes, type 1 depends less on genes. Though heredity is one of the contributing factors in type 1 diabetes, but there are many more other prevalent factors. If both parents have type 1 diabetes, the likelihood of their child developing type 1 is more than if one parent has diabetes. Similarly, if the parent has contracted the diabetes in early age, then the risk factor increases further. Also, the patient should not have a limited role in preventing the type 1 diabetes, as they can take certain actions. If one of the parents has type 1 diabetes, they should regularly screen their child for type 1 diabetes. They should ensure their child's sugar level is regularly monitored. Healthy eating habits and exercise should be incorporated daily in their schedule.
All right, so a healthy lifestyle and inculcating these good healthy habits must be mandatory. Now, I think we've all realized the importance of health and immunity and the role a healthy lifestyle plays. Dr. Ravi, should it be mandatory for people with type 1 diabetes to use technology like continuous glucose monitoring for better blood glucose control and also to avoid hypoglycemia episodes?
Yeah, thus far we've been using glucometers to monitor blood glucose levels, checking them at the comfort of our own homes and offices, and making sure the blood glucose levels are in the target range. But we do have technology over the last 15 years or so called CGMS, Continuous Glucose Monitoring Systems, which can be used in the form of a small patch that is put somewhere across on your shoulder, and which is painless, which can monitor your blood glucose levels indirectly by checking the capillary or interstitial glucose levels, to be precise, every 5 to 15 minutes. And each patch can last from 7 to 14 days. Just see how beautifully it can monitor your glucose levels without pain, without picking yourself every 3 to 4 hours. I mean, it's wonderful technology over there, and I think type 1 diabetics can really use this technology in order to monitor their glucose levels in real time and with no breaks and without any pain as well. I think it's wonderful technology over there. For that matter, even type 2 diabetics, gestational diabetics, people with secondary diabetes, anybody can use this technology. It is wonderful technology, and it would certainly facilitate better glucose control.
All right. Now, Dr. Hamdulay, lockdown has disrupted the routine of people. Over this last year and a half, people have missed routine blood tests, in fact, and other health-related tests. Can you please advise patients which tests should people do regularly to keep a check on their heart health?
So as pandemic is settling and we are all getting back to our routine, so I would advise all those patients who have been affected by COVID-19 to approach their doctor and get them investigated. Now, it's important that they have a complete heart checkup, because it has been seen, as we all know, that COVID-19 has been affecting even heart. So we get our ECG done, stress test, 2D echo, cholesterol level, and BNP as we call, which will give us the status of the heart. Based on the information, then we can diagnose whether the damage that has happened because of COVID-19 was temporary or it is permanent. And if it is permanent, then the physician will start you on treatment immediately.
All right. Thank you so much for that, Doctor. We'll slip into a short break and return with more on how to stay healthy post-pandemic. Stay with us. Welcome back to our special show, Beat Diabetes, Myths and Facts. And let's go across to our panel of doctors for healthy living. And Dr. Aastha, if you could tell us how common the episodes of hypoglycemia are in people with type 1 diabetes, and what precautions should they take to avoid it?
Hypoglycemia episodes or low blood sugars are quite common in type 1 diabetes. So anyone who has type 1 diabetes has to understand what can cause low blood sugar levels. Most common causes are increase in exercise more than the usual, taking too much of insulin, not eating enough food at the right time, or taking unhealthy food also. The type 1 diabetic patients should keep a strict control and maintain balance between their insulin levels, exercise and diet, and adjust their insulin intake accordingly. Continuous monitoring of sugar levels is the key to reduce hypoglycemic episodes.
All right. Dr. Ravi, how should diabetes patients adjust their insulin doses before, during and after exercise? And is it necessary every time that they should take medical advice before starting their exercise regime?
Yeah, exercise can have a variety of effects on blood glucose control, but most commonly exercise can cause low blood glucose readings, which we call as hypoglycemia. So it is very important to make sure that somebody who is on insulin, or for that matter even oral anti-diabetes medications, check their blood glucose levels by using a glucometer or CGMS, as we earlier discussed, before they start their exercise routine. And if at all they were to notice that the blood glucose levels are slightly on the lower side, for example 80 milligrams or 90 milligrams per deciliter, it is essential that they take a healthy snack before they start their exercise. As to whether they need to monitor their blood glucose levels during exercise, if it were to be 30-40 minutes or 1 hour routine exercise which they are used to, and if their blood glucose levels are usually stable during that, they don't need to check during the exercise. But if at all they were to do a long haul of say 2 hours or 3 hours exercise, or planning a half marathon or something like that, it is essential that they check in between their blood glucose levels using a glucometer or CGMS. Obviously, adjusting the insulin doses according to their blood glucose levels is also pertinent and important.
All right, Dr. Hamdulay, how can you define an elective surgery in the field of cardiology? Are all heart surgeries essential and on emergency basis, in a few cases that we can wait till the pandemic condition improves? Because, over the last year and a half, a lot of people have put off surgeries that were required of them. What would you advise them?
So no cardiac problem can be ignored. It will take hardly any time from elective to somebody to become an emergency patient. So what is important is to get yourself checked by a doctor. He will define whether your problem is it can be medically managed or it needs an intervention. If doctor decides that this can be medically managed, then it's better to postpone the surgical intervention till this pandemic is over. But in case if he suggests that this has to be addressed as soon as possible, then there is no time in wasting and no time to ignore your symptoms. I would suggest them to undergo surgical intervention or any form of intervention, sooner the better.
All right. So always consult your doctor and, don't make any decisions on your own. Dr. Aastha Gupta, is a woman with gestational diabetes and her child at increased risk of future diabetes?
Unfortunately, yes. There are high chances that the child and the mother may develop diabetic-related complications in the future. So for both child and mother, early detection, continuous monitoring and regular exercise with healthy, balanced diet are key for normal and healthy lifestyle.
All right, and let's get another question on cardiac health. And Dr. Hamdulay, many years of scientific studies have shown a close relationship between cardiovascular disease and cholesterol levels. Should one focus on lowering dietary cholesterol or saturated fats?
Yes, there is a connect between your cholesterol level and cardiac disease. There is something called as bad cholesterol and good cholesterol. So all our efforts have to be there to increase our good cholesterol and decrease our bad cholesterol. How? I would suggest that we have a proper diet charts. We approach a dietitian if necessary, and try to cut out our food habits in such a way that we consume food which are good for our heart, which can reduce your bad cholesterol, which is known as LDL or VLDL, and help us to increase our good cholesterol, which is known as a high density lipoproteins.
All right, and coming back to the question of gestational diabetes, Dr. Ravi, what steps can a woman take to better manage gestational diabetes?
Well, to begin with, I think we need to reiterate the basic fact that blood glucose levels ought to be as close to normal as possible if we really want optimal maternal-fetal outcomes during gestational diabetes. And in order to achieve this, one needs to focus on good amount of exercise as is allowed by the obstetrician, good diet control as is advised by the dietitian, and not to forget the importance of medications, be it metformin or insulin, that have been prescribed by one's endocrinologist or physician. So if we put all these together, and if the person were to lead a healthy lifestyle, i.e. sleeping on time and keeping follow-ups with their doctor regularly, then obviously one could achieve the optimal outcomes pertaining to maternal-fetal outcomes, even if they were to have gestational diabetes mellitus. So stick to the basics, be it exercise, diet control, or taking medications and keeping regular follow-ups. That's the mantra.
All right, so that's the mantra. Well, thank you so much, doctors, for taking our time and talking to us about these very important issues of how to manage health and beat diabetes. Thank you all for watching at home. Goodbye.